Okay, so welcome to the June webinar of the McLean Hospital Crafting Support Project 2026 Family Webinar Series. I'm Dr. Julie McCarthy, and I'm a clinical psychologist and researcher at McLean Hospital. Tonight, I am very excited to have you with us for a presentation on empath, what to know about psychosis and connecting to care with Dr. Emily Gagen, director of empath, Natalia Nodiff, a young adult peer mentor, and Tanya Trevett, family consultant, all at the Brookline Center for Community Mental Health. And before we begin, I'll go over a few reminders. So folks are welcome to change their names for privacy as you make questions or comments in the chat anonymously if you prefer. Definitely ask your questions and put them in the Q&A box or chat, and we'll answer them at the end of the presentation. And then we do ask that you use the polls for audience participation or to share any resources that you'd like us to know about. And we are recording the presentation and Q&A, and when recordings are available, we'll let folks know. And the last two webinars are already online. And to continue to improve the webinar series, we encourage you to complete a brief, anonymous, completely voluntary feedback survey at the end to share your thoughts, preferences, or ideas for future webinars, because we want to make this as useful for everyone here as possible. And this information helps us for quality improvement purposes and may be shared anonymously with other researchers or folks in the future who are interested in expanding support for family services. So if anyone needs to go early, I will put that in the chat now. Okay. All right. So first up, we'll go over our agenda for today. So I'll talk a little bit about the Crafting Support Project briefly for anyone who is new. Then we'll dive right into our presentation. We'll do Q&A, and then we'll end with closing remarks. So first, I would love to see who all is here with us tonight. So let me put our first poll in the chat or on the screen. So if you don't mind, please feel free to share what best describes your role or roles. You can choose more than one. So family member, person with lived experience with mental health challenges, clinician, or none of the above, in case we missed other categories. Thanks so much, everyone who is putting in your votes. And someone put in the chat, family member. Great, thank you. All right, so I will close the poll in 3, 2, 1. Okay, and so it looks like we have primarily family members with us, and we also have a number of clinicians as well, and then some folks with lived experience. So thank you all for being here. Okay. So what brings us here is the Crafting Support Project Family Services. And so this is really something that became a resource, a growing resource for folks who were in the position where they were either in their personal lives, kind of working with folks who were trying to get support for their loved ones involving mental health, or in professional life, thinking about how to, best understand the resources that could be useful for family members and other clients that they're working with. And so with the generous donors to McLean Hospital, we were able to put this series together. And this is our 4th year now, I believe. So we're excited to keep this going. Okay, and thus far, we've had a couple webinars already, and here's our schedule for the exciting topics to come. And if you've missed any of the webinars from this year or prior years, please feel free to check out our Crafting Support Project YouTube channel with all the webinars free online. And if you're interested in one-on-one coaching, we use a craft-based approach, include motivational interviewing and CBT or cognitive behavioral therapy for folks who are located in Massachusetts. You can meet on Zoom or potentially in person with me or someone from our team for usually 8 to 10, and if needed, up to 12 weekly one-on-one sessions. And this is insurance-based. All right, so before we move into our presentation for tonight, our second poll is really about your familiarity with our topic for today. So let me pull that one up for you. Okay, so this question is, how familiar are you with the Massachusetts Psychosis Access and Triage Hub, or this term empath? Not at all familiar, mildly familiar, maybe moderately familiar, or very familiar. Okay, so we're getting a little bit of a range. All right, and we'll close the poll in 3, 2, 1. All right, thanks so much. So sharing the results on the screen, we have most people who are not familiar with empaths. So you're definitely in the right place. Folks who are mildly or somewhat moderately familiar. So it sounds like there's still a lot of room to learn about our topic for today. So thank you so much. And to introduce our presenters, I'll share a little bit about them. So Dr. Emily Gagen is a licensed clinical psychologist at the Brookline Center for Community Mental Health. She's the director of the empath program and is also a member of the team at the Center for Early Detection, Assessment, and Response to Risk, or CEDAR. And Natalia Nodiff is a young adult peer mentor at Empath, where she works alongside the team with clients using her lived experience to provide insight and guidance. While most professionals understand psychosis from the outside, she knows what it's like to go through it firsthand. And Tanya Trevett is the family consultant, a best-selling author, coach, mother of 3 teens, and she's spent the past 15 years navigating the mental health of youth in schools and at home. And she also has a book in help. I'm failing as a mom. And so she brings a lot of expertise, from her lived experience too. So we're so excited to have all 3 of you with us today. I'm going to stop sharing my screen and I will turn it over to you, Emily. Thanks so much.
Great. Thanks, Julie. Yeah, it's nice to have everyone here. Thanks for joining. I will share my slides. So the plan is that I'm going to share some information about psychosis in general and symptoms, and then also how family members can try to support loved ones who might be experiencing psychosis. And then we'll talk about Empath as a resource. It is a Massachusetts-based resource. And then both Natalia and Tanya will share some of their stories with you all, and then all 3 of us are happy to answer questions towards the end. So to start off, psychosis, when we say psychosis, that in itself is not a diagnosis, right? Psychosis is a set of symptoms that refers to when someone has some difficulty telling what's real from what's not, or where there's some loss of contact with what we would consider to be consensus reality. And what we mean when we say that is among a particular group of people, based on that group of people's shared experiences, common understandings of reality, we come to this kind of consensus about what reality is. And that can differ group of people to group of people. So when we think about psychosis, that's when someone has experienced some departure from that. And a person can experience psychosis in a number of different contexts, right? So it could be directly related to substance use. It could be related to medical issues, maybe neurological issues like seizures, maybe sleep deprivation. And then maybe most familiar to folks, it can be related to mental health concerns like schizophrenia, bipolar disorder, or depression. So this is how we think about the symptoms. We think of them in mainly two big categories. So on the left, we have what we call positive symptoms. And in this case, when we say positive, we don't necessarily mean good, but we mean added on to a more typical or normative experience. So that can include delusions. So those are beliefs that are, again, not consistent with our consensus reality. That can involve elements of paranoia, so worrying that someone might be trying to harm you, out to get you, plotting against you in some way. Folks might also experience hallucinations, so that can mean hearing voices, seeing visions. But this, along with a lot of these symptoms, does exist on a continuum, so it does look a lot of different ways, and I'll talk more about what I mean by that in just a moment. And then also disorganization. So folks can experience the thoughts in their mind as being disorganized, right? Thoughts feel jumbled, hard to know kind of what's going on in your mind at any given time. And then that can result in disorganized communication. So having trouble getting your point across, right? Or having other people understand what you're trying to say. And then also disorganized behavior. So here we mean behavior that's just really out of character for someone, really off someone's baseline. Sometimes that behavior can appear erratic. Um, and then on the other side, just like positive means added on, negative means reduced, again, from a more typical or normative experience. So that can involve reductions in emotions. So that's in experiencing emotion and then also in showing emotion. So folks might have what we call flat affect, right? Hard to know what someone's feeling just by looking at their face. Folks might also have reductions in social interaction, so not wanting to interact with others, withdrawing from other people, maybe not wanting to do the things you used to enjoy. And then also maybe trouble generally with functioning. So folks might struggle with motivation, maybe some trouble with self-care, and then also sometimes some cognitive trouble, right? Trouble with memory, attention, things like that. But we think about these symptoms as existing on a continuum. A lot of times I think folks think about psychosis as being present or absent, right? Someone has psychosis or they do not. And instead, I really encourage folks to think about it in this way, as existing on this continuum. And the way that we think about it varying along the continuum is in terms of how common the experience is, how much distress it might cause someone, or how much it gets in the way for them, and then how certain someone is that what they're experiencing is truly what's happening. And everyone, all of us, are somewhere on this continuum. So if we look at this top example all the way to the left, someone might have the thought, I don't like my landlord. Probably, unfortunately, but probably a pretty common thought. But, chances are, I guess, depending on your landlord, but it doesn't cause you a ton of distress to have that thought, right? Or it's not necessarily getting in the way for you. It's one thought of many thoughts that you have in your mind. You can still go about your day doing what you need to do. A little to the right, someone might have the thought, I'm not sure why, but I don't trust my landlord. Still probably a pretty common thought. It might cause you a little more distress to have this sense, this kind of vague sense that you can't really trust this person. But the way that it's phrased, I'm not sure why, but I don't trust my landlord. Meaning if someone were to say to you, actually, I know that guy. You have known him a while. He's maybe a little weird, but he's a great guy. Like I like him a lot, and I think he's really good, and I think he's a good person. And you could hear that and then decide to change your mind. You might hear it and say, yeah, you know what? You're right. I jumped to conclusions. Yeah, I think maybe he's a little odd, but you're right. He's been a good landlord since I've lived here, and I think I just judged too fast. So you could hear that information that's to the contrary and change your mind. A little more to the right, someone might have the thought, I think my landlord might be trying to poison me. Probably not a common thought, but I think you can imagine if you had that thought in your mind, how much distress that would start to cause you, right? How much space that would start to take up in your mind, how much that probably would start to change who you talk to, where you go, what you do. But here we're not 100% sure, right? I think my landlord might be trying to poison me. So we haven't reached that 100% certainty, but we do have this feeling that there might be something going on. And then all the way to the right, someone might have the thought, my landlord poisoned the air and I'm sure he wants to kill me. Again, not a common thought, but again, I think you can imagine if you had that thought, now how much distress that really would cause you, right? How that would probably take up almost all the space in your mind. Probably change almost everything about who you talk to, where you go, what you do, right? And now at this point, we are 100% sure, right? He poisoned the air and I'm sure he wants to kill me. So now there's no room for other information or other alternatives. This is, what we're certain about is going on. So I really encourage folks to think about it in this way because I think it can go a really long way, especially when you're interacting with or talking with perhaps a young adult who is experiencing these symptoms and maybe feels like they're the only ones that are having this kind of experience. And instead of thinking about it as something that you couldn't possibly relate to, because maybe it's something you haven't experienced, but instead being able to put yourself in that person's shoes a little more and kind of better understand what that might be like. Because I think, again, that can go a long way. When we think about the kind of onset of psychosis, so most commonly when we think about early psychosis, that's really late teens to early 20s is the time that's often happening. But we're often seeing some signs of risk prior to that. These signs here, especially the top four, could be attributable to a million different things. So I really want to make that clear that like those top four, we could say are related to someone experiencing depression, anxiety, generally just being an adolescent or a young adult, right? Things like that. So when we think about risk for psychosis, of the risk of someone being, at a higher likelihood of developing psychosis in the future, we're thinking about that general difficulty that someone's having, right? This new trouble with work or school, this new trouble concentrating that someone did not have before, this new trouble with self-care, social withdrawal, and we're looking for the things in darker yellow when we think about risk for psychosis. So someone might have a lot of unusual or intense ideas that are taking up a lot of space in their mind. Someone might have some of those elements of suspiciousness or paranoia, worrying about, someone trying to hurt them. Perceptual changes. So maybe they're not hearing voices or seeing visions, but maybe there's this new sensitivity that they have to light or sound that they did not have before. And that's kind of just a new thing that's come on recently. Sometimes people will describe it as just feeling like their mind is playing tricks on them. So really wanting to kind of ask more questions about that or find out more about that too can be helpful. And then we also think about if there's a close relative that has serious mental illness or psychosis in particular, because that can increase the risk. So the other reason that we think about this is because we want to, because empath works mainly with young adults, which I'll talk more about in a little bit. And the reason for this, adolescents and young adults, is that the sooner we get someone into treatment after experiencing psychosis, the better the chances are of things going well for them over the course of their life. We call it reducing the duration of untreated psychosis. So it's just shortening that time frame between when someone first has psychosis and when someone first receives treatment. And the shorter that is, the better that someone can do over the course of time. Importantly, symptoms of psychosis do not mean that someone is unsafe or that someone should be in the hospital. There are many people, I think you can assume, and I hope folks here are aware, right? Many people in the community experiencing symptoms of psychosis, and by no means does that mean they should be in a hospital. And in fact, aggressive behavior and violent acts and things like that, they are not symptoms of psychosis. They are not associated with that. And in fact, also, folks with psychosis are actually 14 times more likely to be the victim of violent crime rather than a perpetrator. But because of stigma, the media doing a bad job of telling us, right, what psychosis is and isn't and what it means, we can sometimes, those things can get kind of mixed up or conflated, right? And so instead, we want to be thinking about how stigma, someone deciding to share about their symptoms, stigma may keep them from doing that, right? Because they're worried that people are going to think that they are unsafe or dangerous in some way. And that means that they might not get help as soon as they might need it or want it. So how might you talk to someone in your family who might be experiencing psychosis? Again, at Empath, we think about young adults or adolescents, but this can be true for any family member who might be experiencing symptoms of psychosis. It can sometimes feel like it's hard to relate or it's hard to understand where someone might be coming from, right? Especially if someone is describing to you an experience or a belief that they're having that you feel like isn't true, or that you feel like you have, evidence to show like, oh, actually, you don't have to worry about that because here are the reasons why what you're, thinking is not true. So, don't worry. It can feel like that might be the most helpful way to kind of fix it for people, right? Excuse me. And that might make logical sense. If we can get someone to stop thinking these things, maybe they'll feel better. And if you think about something you believe really strongly, for example, and someone tried to sit you down and just tell you all the reasons why you're wrong, that might not feel great, right? Despite your maybe best of intentions in doing that, that's actually probably going to feel like you're not listening, right? It might feel invalidating. So instead, what I'm always trying to do as a clinician, but I think this is true, for families and friends as well, is trying to listen to someone, right? Trying to just be curious and want to know more about their experiences. What you can also do is listen for or guess at what the emotions might be that are underneath what someone's experiencing. So, for example, say someone has this really strong belief that the world is a computer simulation and they're the only person that's real. And they're, thinking about a lot, it's taking up a lot of space in their mind. What I would probably want to say is, man, that sounds like that's probably really confusing. And it sounds to me like you probably feel really alone. Can you tell me more about that? Right? Because in that case, then I'm kind of trying to use my mind to say like that if I were experiencing that, I would feel really alone, right? If I were that the only person. Um, so really trying to kind of reflect back that emotion that you might be thinking someone is feeling, because that can also be a way to like demonstrate that you're trying to listen and you're trying to understand. Because also if you think about, if someone is telling other people in their life about these beliefs, it is probably likely that they're met with, more reactions that are like, what are you talking about? That doesn't make any sense. Just stop thinking about it and you'll feel better, right? Or just put your mind on something else. So if you can be a person who's not doing that, and instead kind of being willing to listen and think with someone as much as you're able, that can be really powerful for someone to feel less alone and heard a little bit more. Um, Another way to do this is to try to listen from what we kind of call like a position of not knowing. So trying to start with more like curious questions, right? Getting at that curiosity I was talking about before. Um, so instead of those questions on the right in that table of kind of questioning like, well, did that really happen? Or man, that sounds really unlikely. Or maybe if you just stop thinking about it, then it'll go away. But if you can instead be a little more open to like, okay, so help me understand what is it that's going on? Like I'm trying to follow, or I wonder what that's like. I wonder, how you started thinking about that. And then also just asking more about it, like what makes that, so scary or interesting or exciting, whatever it is. But again, still trying to just lead with that kind of curiosity, empathy, um, with trying to not be too kind of more prescriptive or telling people what you think they should do, right? Or kind of being judgmental about it or, things like that. Um, so other ways that you might support a person in your family, right, who's having these experiences. So really trying to focus on connecting too, right? And some of these questions might help frame your thoughts about this. So of course, like what is your relationship like already? Like, are you guys pretty close? And so you can kind of build on that, or is maybe things have been kind of tough and you want to kind of think about how to navigate that. What might you already know about what they're going through that you can kind of use as information to say, like, well, I remember that you were telling me about this. How is that going? Is anything else going on? Also, what have they, and also you, already experienced so far in terms of like the mental health system, right? Or with mental health care or mental health in general. Sometimes people have had negative experiences with the mental health system, right? That might impact their interest in, willingness to, right, engage with the system in that way. And then also what beliefs or cultural values might someone have that might shape how they understand what's happening. Also an important thing to keep in mind. And how might you stay supportive, right? Does your loved one want you involved? Maybe they need some space right now. They're going through a lot, and actually the most helpful thing is just for them to know you're there, but to kind of be a little bit removed, right? And just say, I'm here if you need me. Are there ways to stay connected? Like even if they're not sure if it'll be helpful, but maybe, checking in here and there. Thinking about what kind of support works best for your particular family, right? Is it more of the emotional kind of, um, feelings based side of things, right? Or is it more logistical? Or is it advocacy, helping people connect to resources? And, just thinking about how can you maintain trust and respect with someone while still offering help. But really the overall goal is trying to be present, to listen, stay calm, right? And really thinking about leading with compassion rather than trying to control or change someone's behaviors. Um, a few quick resources here. Folks might be familiar with some of these. I think you guys will hear from Dr. Xavier Amador later this summer if you come to that one. He's part of or founded, I think, the LEAP Institute, the LEAP approach. He also wrote that book on the right, I'm Not Sick, I Don't Need Help. but it can be a helpful framework for how you might think about communicating with family members who are experiencing psychosis. A couple of other things, motivational interviewing for loved ones, or MILO. Dr. Emily Klein wrote this book based on that approach called The School of Hard Talks. It is not specific to psychosis, but it was developed initially for families of young people with psychosis. And then they kind of generalized it to be more applicable. And then Psychosis Reach is developed by the folks at the University of Washington. I think there's been a talk from those folks here as well, maybe in past years. But another great kind of framework to participate in, to learn more about how to, support yourself and your family member. And then a book written by Ken Duckworth, who was the leader of, I believe, the leader of NAMI for many years, but how to navigate the mental health system. In terms of treatment, so there are specialized clinics, I think in all but one, maybe, of the 50 states now, that specialize in working with adolescents and young adults who've recently experienced psychosis. The model of care they use is coordinated specialty care. And the idea is that someone receives all of their outpatient mental health services from one team who all works together to coordinate to provide this care. And the reason, again, that we focus on adolescents or young adults is for that reason of we're trying to shorten that time frame that someone's experiencing symptoms so we can help people move forward in their lives. So from that team, someone receives, kind of weekly therapy, maybe like a monthly meeting with a psychiatrist, work and school support, sometimes peer support, family therapy. To find these clinics in states that aren't Massachusetts, there's a SAMHSA link here. I know you can't click on it, but if you search SAMHSA and early psychosis, you'll likely find that locator, and so you can find clinics in your area. If you're in Massachusetts, I would encourage you to call Empath to help figure that out. So we are a statewide free resource. And the goal is to help people in Massachusetts connect to those kinds of clinics I was just describing, and then offer support along the way as they're kind of working on getting connected to those clinics. And then we also consult with providers, therapists, doctors, school counselors, things like that, where we're kind of helping them to work with folks who might be experiencing psychosis. This is our team. Two folks here today you'll hear from in just a second, Tanya and Natalia. But the kinds of things we do are we do presentations in the community about psychosis to, like, say, groups of therapists, doctors, school counselors, things like that. Natalia also developed a workshop that we do with young adults where we're teaching them about psychosis and how to support a friend or themselves if they're experiencing that. When we hear from people, we have a quick phone call to kind of figure out what's going on and how we can help. Importantly, Empath does not do any treatment. So Empath does not do therapy, does not prescribe meds, etc. But we're trying to help people get to that next step. A big piece of support we can offer is Natalia, who can meet with folks to talk about her own experiences and be a support and a resource for other young adults. And then also we have family partners who can meet with families to talk about their own experiences. And then, as I said, for consultation with providers, we can meet with providers or teams of providers to kind of talk through cases and offer some suggestions and recommendations and things like that. So if in Massachusetts, if you wanted to reach out to us, you could call or email, or we have an online form. We would want to chat on the phone for a few minutes, and then we can meet on Zoom. We could help you connect to Natalia or our family partner. We could help with referrals, could help connect to support groups. But really, we're trying to be like a hub of information to help people get to a next step of care. So I'm going to turn it over to Tanya, who's going to share with you, and then we'll hear from Natalia after that.
Great. Thanks, Emily. Hi, everyone. It's great to be with you tonight. I hope my talk really kind of discusses and goes over what I wish I had known about psychosis as a caregiver when my loved one was going through this. My loved one experienced a first episode of psychosis during college. Before that, we had many years of mental health challenges, but nothing prepared me for psychosis. We were always extremely open about mental health. We didn't let the stigma hold us back. We sought help when we needed it. Still, I didn't recognize what was happening to my loved one. My loved one's sleep collapsed. School suddenly became much harder. Fear and suspiciousness started to grow. And I really kept trying to explain these things as either stress or anxiety or the pressures of college. I'm not a clinician, but I missed the early signs because I didn't know what I was looking at. When things became more serious, I felt overwhelmed, frightened, alone. I really had every possible feeling. I wanted answers. I'm a mom. I wanted a roadmap. I wanted my loved one better. And most of all, I wanted someone to tell me that there was really hope, and there was reason to have hope. Instead, I heard things that no caregiver ever forgets. I was told that my loved one probably would never return to school. They might never hold a job, and that they likely would never live independently. In a matter of days, the future that I thought was possible seemed to disappear. And I wasn't just grieving what was happening in the moment, I was grieving a future I thought we had lost. I didn't know any other caregiver who had lived through psychosis. So I was alone in this. I was up at 2 in the morning, Googling for answers, trying to piece together what to do next. And I felt completely alone. Empath didn't exist at the time. Looking back, there are three things that I wish I had known. First, psychosis is treatable. I wish someone had told me that recovery was possible, not guaranteed, not quick, and not always linear, but possible. When you're in the middle of a crisis, it can feel like the person you love is gone forever. It can feel like everything has changed overnight. But psychosis is not the end of a person's story. And then secondly, don't argue with the experience. And this is one of the biggest mistakes that I made was trying to convince my loved one that what they were experiencing wasn't real. I thought it was helping. Instead, it often increased fear and damaged trust. When symptoms were at their worst, it felt like it was me against my loved one. And over time, I learned to stand on the same side, us versus the problem. And that shift changed everything. And Emily described this as psychosis being on a continuum. And this shift in thinking really has changed everything for me. I learned that I didn't have to agree with a belief to acknowledge the emotion behind it. Instead of saying, that's not happening, I could say, that sounds really frightening. Help me understand what that's like for you. Or just simply, I'm here for you. Those responses can help us stay connected when things feel most difficult. And then third, if something feels off, reach out for help early. Looking back, I now see all the early signs before the crisis. Sleep was disrupted. There was withdrawal, both from my loved one and then people surrounding my loved one pulled away. Difficulty functioning, sensitivity to lights and sounds, growing fear or suspiciousness. And when several of those things started happening together, I wish I had known to move toward help sooner. You don't need to have all the answers before asking questions or seeking support. One of the most important lessons that I learned was that my role as a caregiver wasn't to fix everything. And this took a lot of time for me to really realize that I didn't have to fix everything. My role was to stay connected, to listen, to validate, to help create safety, to keep showing up. And my steady presence, calm, curiosity, connection, empathy, and consistency was part of the care. And what ultimately made the biggest difference for my loved one was coordinated care, treatment, support, education, and of course, time. And here's the part that I wish I had told myself in those darkest days. The predictions were wrong. My loved one did return to school. My loved one does work, and my loved one does live independently. The road was definitely not easy, and recovery did not happen overnight. But the future that seemed lost was still there. That's why programs like Empath matter. No caregiver should have to navigate this alone. And if there's one thing that I hope you remember today, it's this: psychosis is treatable, you can relate, recovery is possible, and neither you nor your loved one has to walk this path alone. And with that, I'm going to end and hand it over to Natalia. Thank you.
Thank you, Tanya, and thank you all for being here. So I'd like you all to imagine psychosis as a question, and it's when we all ask ourselves, what is real? Most of us ask that out of philosophical pondering, but in crisis, that question can become a spiral, and how we respond matters profoundly. When I was 15, I was a lonely, depressed kid, constantly fighting with my parents. A few months after starting a medication, something unexpected happened. At first, it felt profound. I saw the answer to the universe in a cup of green tea. Words were forming in tree branches. A vision of an alien sent me running and screaming into another room. Then voices started. They were telepathic messages from my favorite rock stars. The voices comforted me, but I knew something was wrong. I went to my guidance counselor to ask for help, but my speech fell apart into disjointed phrases that only I understood. I was sent to a specialist and then hospitalized. Clinically, I was labeled with acute psychosis, but inside it felt like a spiritual rupture, something meaningful, sacred, and terrifying all at once. While hospitalization can be necessary, it can also be very frightening. In that unfamiliar environment, people kept their distance from me. I was seen as a threat and put into isolation. And the more frightened I felt, the deeper I went into psychosis. I didn't feel safe. I didn't feel like anyone cared about me or my fate. My only comforts were the voices of my rock stars. But what I truly needed was a real human connection. Things shifted when I recognized my new psych ward roommate. She was someone I knew from Sunday school, and she wasn't afraid of me. She held my hand. She treated me gently. And those small moments of compassion helped regulate my nervous system in a way that medication alone couldn't. My symptoms eased because someone dared to connect with me. After 3 months, I was discharged, but with a devastating prognosis. I might never be able to attend college or work or live on my own. But that prediction failed to account for my self-determination and for people who believed in me. My guidance counselor saw potential in me, and with his encouragement, I was able to push through senior year, completing a project, and to my shock, received the school's Resilience Award scholarship. That moment reflecting not just my academic achievement, but the power of my recovery. Over time, I found other ways to heal: art, music, writing, meditation. I took up the ethereal instrument, the theremin. I learned mindfulness, which helped me stop searching for cosmic meaning in everything and ground myself in my body in the present moment. I went on to study arts and psychology. I led a college meditation club. I've lived independently and worked for almost 2 decades. I'm now an artist, musician, writer, and peer mentor. My life is bigger than the diagnosis I was once handed. When young people begin questioning what is real, they need more than just the clinical lens. They need connection, empathy, and hope. You could be the person who shows up for someone in psychosis with a compassionate presence that regulates someone's nervous system and potentially changes the course of their condition. And today, young people have access to supports I didn't have. Programs like Empath can help them avoid the isolation and fear that I went through. By connecting them early, we can help them step into their future with hope instead of fear. We can help them find their way. And this image here is an illustration I made after my hospitalization. It depicts one of my hallucinations, which were words and tree branches. It says, "I will find my way." Thank you.
Thanks, Tanya. Thanks, Natalia. Yeah, I think that's kind of the end of our presentation. But Julie, if there are questions that folks have, happy to answer those. I'll stop sharing for now.
Great. Thank you so much for that amazing presentation. I really appreciate hearing from all of your different perspectives. And so, yeah, for folks, if you have any questions, feel free to put them in the Q&A or the chat. We're getting a lot of praise, for all of your, beautiful testimonials. So thank you so much for sharing. To kick us off, I had a question about empath, because sometimes the families that we encounter are a little bit unsure about whether their loved one has psychosis or not. And I really appreciated your comment, Emily, about how things like violence or aggression are not actually a psychosis, because that is a point of confusion that can come up. So if a family is a bit unsure for themselves about whether or not their loved one has psychosis, is it appropriate for them to contact empath?
In Massachusetts, yeah, absolutely.
Yes. Okay.
Yeah, for sure. The we don't do at Empath, we're not doing like formal evaluation or
Sure.
assessment, so we're not going to answer the question of whether we're sure someone has psychosis. But
Mhm.
there by no means is no need that we need some sort of proof that we've figured out already that someone has psychosis. In fact, a lot of the questions we get from families and from providers are, here are some of the things that have been going on with my adolescent, my young adult. What do we make of this? And so we're trying to just kind of talk through it with people and kind of make some
Mhm.
recommendations for next steps, give some education, things like that.
Definitely. Thank you so much. So it sounds like people can be pointed in the right direction.
Yes.
Another question is, if someone needs coordinated specialty care, like maybe accesses one of the clinics through that SAMHSA website, is that type of care typically covered by insurance?
So most clinics are, and there's someone from a CSC clinic here. That's great. Yeah, so most clinics are billing those services kind of as they are delivered, meaning someone, assuming the clinic takes your insurance, then they're billing for that therapy session. They're billing for that medication with a psychiatry medication appointment. They're billing for that family therapy, things like that. So it's billed in the way that those services would be kind of in other spaces. But the idea more so is that this team is all kind of coordinating as opposed to maybe at a regular mental health clinic where like the therapist is over here and the psychiatrist is over here, and maybe they don't like communicate as much. But we try to talk a lot more together about cases we're working with and how we can kind of have a more coordinated approach to that type of care.
That's good. Thank you so much. Someone had also asked if this meeting is being recorded and could be accessible in the future. Yes, it is. We will post this on our YouTube site for the Crafting Support Project. And so another question had come in about how long it took to be able to work and live independently and move on with life. I think this question is for you, Natalia, after that experience, for instance, at the hospital that you had.
So it's been a long journey, and I've had multiple episodes that were I would say after a single episode, it took at least a couple of years to kind of get back on track again. That is my experience. I can't speak for everyone's experience though. And it took a lot of time to accept my that I would need ongoing support. I didn't want to
Mm.
take meds for a while. So and to answer the other question, I do take meds despite my initial experience. I had a bad reaction, but I'm now on the right set of medicine that does help me, and I'm thriving now.
Wonderful to hear that.
Julie, do you mind if I just add
Yes,
one
please
thing? Okay.
do.
I just wanted to share because experiences, of course, are always different. My loved one was able to work part-time during recovery, which was really instrumental in her recovery. It made her feel connected to the community. Um, they were uh, working in a Whole Foods, making floral arrangements, and that sense of creativity was really important to recovery as well.
Mm.
So that was during recovery, and then it was a year of recovery, really, and then back to a school full time, and then added work and living independently. So it was really a year-long recovery, and of course, it's never linear, and everyone is different, but
Mhm.
those were our experiences.
Sure. I think a question had come in about creativity, actually, either for experiences that you've seen for yourself or folks that you've worked with. Have you seen kind of ebbs and flows and change with creativity or people's abilities to do the things that they normally would like to do?
Yeah.
Sorry.
No, go ahead.
I can answer that from first person perspective.
Yeah.
Creativity does ebb and flow.
Mm.
It's harder, I think, to access. There's an innate creativity, I believe, to psychosis inherently. The state of it, it's very imagination based, and that can be powerful. But in my life, I've found that I've had to tamper that down just because um, sometimes the medication can actually change my relationship to my creativity, but it's still something I tap into and something I value. But yeah, creativity can come and go. If it's something that's important to someone, it's part of the process.
Thank you. Were there other thoughts that folks wanted to share?
I mean, I think it's, in having such a significant experience, I think folks can kind of feel a loss of a sense of themselves, right? Like who they
Mm-hmm.
are, what they like, what they want to do. And so what might come with that is creativity, but that doesn't mean it can't come back exactly as Natalia is describing, right?
Right.
So I think it can be a common experience and something that, is part of the process of then moving forward in life is trying to find ways that you want to find that again.
That makes sense. Thank you. Another question came in about whether or not any of you or others that you perhaps work with reach out to faith-based organizations in navigating, what is helpful for one's mental health.
Yeah, so Natalia, you can talk about it. So we just this year have really been trying to work more on doing that.
Oh,
And
wow.
Natalia's been doing all of that outreach. I don't know if you want to share a little bit about how that's gone so far, but yeah, we've been trying to make that more of a priority.
Yeah, I've been reaching out to various faith organizations, especially interfaith organizations, to
Mm.
try to spread the gospel of of empath. And we're trying to get in touch, especially with the younger adult facing organizations. But we're willing to work with faith organizations.
Mhm.
Yep.
Great. Thank you. Another kind of related question about who all is involved in coordinated specialty care treatment. Somebody asks, is OT or occupational therapy part of that process or clinic-based approach?
Yeah, it's a good question. No, generally in coordinated
Mm,
specialty care programs that I was describing,
mm,
OT is not part of them. I think
mhm.
here and there may be programs that have decided that that's an important part, which makes a lot of sense. Yeah, yeah, I think it could be really important. But I think as the model was created, which was done through a lot of research studies and things like that, OT was not included in that model. So now the clinics that exist don't, as a matter of course, include OT in their model of care. But I think it's a great point.
And I think you're raising an important context about the research too. So just because it wasn't included doesn't mean we can conclude that it wouldn't be helpful. We just don't
Right.
know. yet. And actually, in one of the programs that I work at McLean, which is a residential program, we have an occupational therapist as part of our team too that works with folks who have psychosis in addition to groups that they may go to or individual meetings that they may have. So it kind of can depend on the type of setting that one may be in. Another person asked about the scenario of, let's say, having a family member who's experienced psychosis and maybe unwilling or not ready to accept help at this time. Would it be proper or acceptable for there to be some boundary setting around receiving that help? And I know every family is so different. Do any of you folks have thoughts about that particular point?
Yeah, I mean, I think it's a question that comes up a lot, especially for, as the question is here, adult family members. So that includes young
Right.
adults, right? And so we can't force people to do anything, right? Unless there's the very like severe situation where someone requires hospitalization and we are, then moving forward with if we're worried someone's going to hurt themselves or someone else imminently. But other than that, we can't force people to do anything. But I think boundaries in terms of like, especially if someone's going to say, for example, continue to live with you, and you're going to maybe support them in some way financially and things like that. Like there are ways to kind of set some boundaries on what you're willing to continue to help with if that person, is or is not going to seek care or things like that. So that can be, I mean, again, as Julie said, a very case by case basis, but that is some of the conversation we have with families who we hear from at Empath that can be a helpful way to move forward.
Any other thoughts from Tanya or Natalia at all about that?
I would just add that that was one of the things that I struggled with. And it's really, really important, I think. And it is something that we hear from caregivers a lot. Setting boundaries is difficult, but if you have a loved one living in your house and you're supporting them, it is important to be able to set boundaries. And I actually, by doing it and by doing it effectively, my loved one was able to get the help and stay with help. So it was important.
It's wonderful to hear that. Okay. There is another question that I'm not sure that I would have the answer to, so I would love to know if any of you do. Someone was asking if there is any association perhaps between things like iron deficiency or lower levels of ferritin with respect to mental health changes or potentially psychosis.
Yeah, not that I'm aware of. I mean, I'm not a medical doctor, so I wouldn't.
Same.
Right. So I don't have that information, but no, that's not something that I'm familiar with. But there are recommendations for, especially when we see symptoms of psychosis in younger kids, that there is kind of a medical workup that can be helpful to seek out. I don't know if that specifically includes iron, so that would be a question for a real medical doctor. But just to say, like there can sometimes be other types of like levels or labs that we're thinking about that might be important to consider.
Yeah, thank you so much. That's such a good point. I know we are here to talk about psychosis specifically, and also, right, one of the things that is outside of our expertise and is recommended is really ruling out other things that could also lead to the symptoms of psychosis, whether that be hearing voices or, believing things that may not be there or smelling things that may not be there, because those could be due to a variety of different original causes. Okay, so another question had come up about, of the people who contact Empath for a referral, how do most of them learn about Empath in the first place?
Yeah, it's a good question. A lot of different places. So as I said in the presentation, we try to do a lot of outreach. So that means we're seeking to connect with outpatient mental health folks, but also primary care and pediatric practices, schools, high schools and colleges. So I would say a lot of those referrals are coming from that sort of those sort of sources that either the providers then are reaching out to us or they're suggesting to their clients or the families of their clients to reach out to us. So I would say that's probably a lot. And then also kind of more like state agencies, like in Massachusetts, there's a Department of Mental Health Department of Youth Services, Department of Children and Families. So we also try to connect with them as well.
Gotcha. That makes sense. Thank you. Another question came up about kind of the course of psychosis. Is it possible that psychosis may dissipate without additional medication that, may need to be administered, in a hospital setting or perhaps any medication?
I think if we're kind of thinking generally about can psychosis be, can start to recede or, without the use of medication. I
Yeah.
think it's really different for different people. I think a lot of
Mm-hmm.
people find medication to be helpful to manage some of the symptoms, and it can take some time to find the right medication that works for someone, which can be a frustrating process. And there's, no quote like requirement that someone take meds.
Right.
Right. So if someone's also interested in engaging in therapy, that can be a really helpful place to kind of think about how to make sense of the experiences you're having and how to manage them and things like that. So I don't think there's one like exact answer to this, but like it's, not always the case that someone must take medication.
Right. And this kind of goes along with the other question that had come in the chat about are there examples of folks who end up tapering off antipsychotic medications and do so successfully? I think that person may be meaning not having continued psychosis. And actually, one of our peer specialists who had presented with his family members as part of our family recovery night last November, the recording is online as well. He actually spoke about his experience with that. And he, for himself, had tried many medications and had safely and in consultation with his care providers, discontinued medication and was able to do so. So there are instances where that works. And also, yes, the evidence-based approaches typically do recommend at least starting with a mix of medication and therapy, but everyone's different. All right, so I am mindful of the time, so we're going to wrap up Q&A and do some closing remarks. Thank you, everyone, so much. And I'm just going to return to sharing my screen in just a moment. Okay, there we go. Oops. Okay. So I just wanted to point folks' attention to some resources that family members might be interested in if you are a little bit more local to some degree to Massachusetts and McLean Hospital. There are different support groups here. Also, we have a newer program, the McLean Pearl program, that we'll hear a little bit more about next time from one of our peer specialists, Lisa Charlin. And for folks who are on the webinar, if you found it helpful, great, let us know. If you think that we could do some additional topics that would be helpful, please also let us know. So I just put that link in the chat, or you can access the QR code on your phone now. And if you wouldn't mind taking just a minute to complete that, that would be really helpful to allow us to continue to provide the most helpful webinars for all of you. And also, I want to thank everyone who has made the work behind this series possible over the years, and also the people who are helping to continue to further our work to support family members and other support persons, folks navigating psychosis recovery. And for our next webinar, we are going to be here at the same time on second Thursday of the month, July 9th from 5 to 6 p.m. with Navigating Mental Health Resources for Families with Lisa Charland from McLean Hospital, Jill Gachuhi from the Compass Helpline at NAMI, Massachusetts, Carissa Rouse from the Schizophrenia and Psychosis Action Alliance, and Maggie Tyler from the Cole Center. So definitely feel free to stay tuned with that. And then also, if you're interested in some resources in the meantime, I believe I should be able to put a link in the chat to our Crafting Support Project resources sheet. So feel free to put that in your files if you would like to save that for later. And so I understand we may not have had a chance to get to all of the questions that were asked. And so we can also send out some additional information by email to address some of those as well. Okay, thank you so much for everyone's time. And if anyone has any questions for me or you want to get in touch, feel free to contact me by email or phone. And we will see you all next time. Thank you so much and have a great night. Bye.